In the next 30 minutes, we're going to still talk about innovation, but a different type of innovation. It's what I call an innovation in business model, innovation in portfolio. So we're going to talk about how Boston Scientific is innovating its offering beyond products to solve fundamental issues that some of our customers have in acute care. So I'll start by introducing Boston Scientific. You may not have a lot of knowledge of what we do as a company, so I felt it was important to start there. Then we'll talk about what is it that our customers are facing, what are the challenges that we see in acute care today, and why is that motivating us to look at those challenges beyond technology, beyond the product. And then we'll talk specifically about what is our approach to serve those customers, and how is that benefiting us as a company, benefiting the hospitals as our customers, and benefiting the patients as the fundamental users of the technology. Right? So Boston Scientific, we are a medical device company in the world of minimally invasive products. So we have products for a number of minimally invasive surgeries that are done both in acute care and ambulatory care. We invest about $900 million per year in R&D, and we have products across 6 areas of the body. Intervention cardiology, so think about the plumbers that solve problems related to blockages in the arteries. We have products in peripheral intervention, so procedures that are designed to treat problems in the circulation of the body. We have products in endoscopy, urology, neuromodulation, and the joint theme across all these divisions is the concept of minimally invasive surgery, which we believe for the patients results in better outcome with smaller length of stay and with better health economics results. What we then realized that many of our customers are facing problems that transcend the actual problems that happen in the operating room. There is an unprecedented financial crisis today with the national health system. You may have seen in the news that hospitals are facing a total deficit of £500 million forecasted for the next financial year. Many governments come and go and they try to transform NHS in different ways, moving budgets from acute care to primary care in a way to prevent people to get sick, and that's a valid strategy. However, when people do get sick, they need treatment, and they need treatment in acute care. And these are some of the issues that our customers are facing. Capacity constraints. Hiring people today is very difficult. Brexit is not going to make it easier, right? Because it will be more difficult to hire people from continental Europe. Quality issues. Length of stays increasing. Readmissions increasing. Over the winter, we see a lot of pressure in terms of bed availability for patients. And when we look at that as a company, we ask ourselves, do we have capabilities to help that? If we don't do anything about it, what is the impact on our business? Can the hospitals continue to introduce the latest technology? Can the hospitals continue to treat more patients, increase the penetration of therapies by million of inhabitants in such a scenario? Here's some evidence that I bring to you of what we see out there, especially on the cardiovascular area, which is closer to our core business. 47% of our customers claim that the demand for their service have already surpassed the capacity they have to treat patients. And here there is a contradiction, because when we look at the utilization of the cath labs, which are the operating theaters that are used for cardiology, the utilization of those machines, of those rooms, is actually very low. It's at 49%. It can be much higher than that. And when we ask ourselves, why is that happening? It's because the bottleneck is not there. The bottleneck can be on what are your processes to prepare the patient? What do you do in the recovery area to discharge that patient sooner, so you have bed availability to then bring the new patient in? How do you identify the patient and diagnose the patient in the first place? Because healthcare is a very siloed industry, with different organizations managing different parts of that pathway, it's very difficult for that to be optimized. People have tried for many years. And another thing that is quite interesting about healthcare is that it's a people-intensive, asset-intensive business. Even though the national health system is a public service, it does cost a lot of money. And building all those facilities, all those hospitals, staffing all those facilities and all those hospitals with very skilled professionals, nurses, technicians, cardiologists, scientists, key opinion leaders, it's also very costly. So a strategy to transform acute care has to be a strategy of consolidating several of those facilities into larger organizations so you can increase the utilization of them. The more fragmented the service is, the more spread the service is, the more difficult it is for the patients to fully utilize all the capacity that is available. And that's the contradiction that healthcare faces on a day-to-day basis. Another interesting aspect that we observe is how difficult it is to manage materials. We're talking about inventories that can cost millions of dollars of pounds sitting every day on the shelves of those hospitals. And they need that product to be available because if a patient has an emergency and comes in and the product is not available, it risks the life of the patient. So how do you manage that effectively, efficiently? We see that because the hospitals end up buying in bulk a lot of products and that sits on the shelf for availability, sometimes the expiration date arrives, and if you don't have a good management of that, that's wasted money with products getting expired and being thrown to the bin. Another very important challenge that we see our customers facing is innovation happens all the time. Companies like ours, they bring new technologies to the market, new therapies. When those technologies are introduced, the awareness that those new therapies exist, it's very difficult to be created because the physicians who actually refer patients for those treatments are spread across the country. When a patient has a symptom, he has to go to a GP, and the GP has to have the proactiveness of deciding to send the patient for an investigation in a specialized center. And if the GP is not aware that a new therapy now is available for a new condition, the GP may decide to treat the patient with the current standard of care, with products that have been on the market for many years. So what we see is the very specialized centers, they struggle sometimes as they introduce new services and technologies to make those GPs aware that those services are available and then attract to the hospital the right and appropriate patient. So all of this motivated us to innovate. We have been in the market for about 3 decades. We started with cardiology products, things like stents, guide wires, pacemakers. And we will always continue to do that. As I said, we invest $900 million per year. But we also realize for those products to be used appropriately, physicians need to be trained on it. Clinicians need to be trained on it. And over the last few decades, we have been offering high-quality educational programs for that training to happen. Besides that, when you think about some of these products that we sell, pacemakers, internal defibrillators, there are small little computers that are implanted inside of the patient to solve electrophysiology problems of the heart. In that scenario, someone needs to go there and actually program what features that little computer needs to have to be effective for that condition of that patient. So in certain therapies, we innovated several years ago, and we offer services. We offer an employee of Boston Scientific to go and support the clinician on the day-to-day inside of the operating theater for the therapy to be optimally applied. And now we are in a situation where we recognize that it may not be enough. We may be able to do more. And we're launching this year, actually we launched 2 years ago, and we're launching further this year, some new programs that we call Advantex, to support the hospitals address some of these financial and operational challenges that I just described. Here's a quick picture of what these programs are about. If a hospital is having financial challenges to invest in new equipment, and it can be third-party equipment from Siemens, from Philips, from GE, from other manufacturers, we have a program to find flexible options for the hospital to make those investments and upgrade that facility sooner rather than later. If on top of that or in parallel, the hospital sees opportunities to better manage the patient flow, better manage how the patient is admitted, how the patient is prepared, better manage how the procedures are booked, try to expand the number of procedures that are done as a day case, optimize the workflow inside of the cath lab, try to reduce the amount of time that people spend between procedures preparing the room and preparing the patient, with a view of doing more with less. We can deploy operational experts to diagnose root causes of problems, redesign processes, and implement transformation initiatives inside of the hospital. If you build a new operating theater and or you optimize their processes, chances are that now there is more capacity available. And chances are that you can now deliver care at a lower cost. If I have a customer in that situation, then I can offer a third service, a service development service, where we bring experts in marketing and business development, and we help the hospital map the population around him. Are we serving those populations appropriately? What is the penetration of therapies in that area? What is my market share as a hospital compared to the other hospital next door? Which therapies do I want to grow? How do I design a marketing strategy to increase awareness of referral physicians of the service that I, hospital, provide? Once the referral physician decides to refer the patient to the hospital, do I have the right outpatient services to absorb that new demand? So these are all the things that my team does in partnership with the clinical teams to be able to transform the way they deliver acute care. Within the performance optimization program, what are the things that we look at? We look at patient flow. We look at supply chain management. We look at how the day-to-day activity is managed. And here there is a new concept, and an interesting concept, which is integration of different solutions. I'm not talking about an IT solution here that will save the day. In our experience, IT solutions can magnify an improvement or can magnify the wrong process. So what we do is we bring together IT solutions from us or from third-party organizations, but we invest a lot of time in looking at processes, change management, and make this an initiative that is led by the clinical team, not by us. When it comes to help the hospital grow, we look into ways of increasing patient engagement, increasing the awareness of patients that they have a condition and new therapies available, increasing the awareness of referral physicians that new therapies available, and then optimizing the outpatient services, not as an operation, but as a strategy to recruit patients. Where I'm trying to educate public hospitals is that they're actually a business. And they need to run those acute services as a business. What are some of the benefits that we see out there? By doing so, we're seeing some benefits in terms of increased revenue of the hospital, which then contributes to the financial health and the reduction of deficit. We see benefits in terms of being able to treat more patients with the same level of staff, with the same amount of rooms available. So here you reduce the cost per procedure by maintaining the cost flat and treating more patients with the same. We see benefits in terms of earlier diagnostics. if now you can reduce waiting lists and see the patient sooner, chances are that you can diagnose the patient sooner as well. We're also developing a program together with Accenture for heart failure patients, where we have a system that hooks up with electronic medical record. It scans across different sites and across different departments what could be patients that have characteristics that could be heart failure, patients that may not be diagnosed yet, but by screening their symptoms, they could be a heart failure patient lost somewhere in another pathway. Then with that information, a team of centralized heart failure nurses can go to different departments, emergency department, general medicine, cardiology, geriatrics, and interview those patients and confirm, is it a heart failure patient or not? Does this patient need specialized care for heart failure? And by doing so, literature suggests that there can be a reduction in the length of stay of patient. On average, these patients can spend up to 12 days in a hospital. What is the benefit to them and everybody if that reduces to 7 days, for example? And once the patient is discharged, the system creates a contact strategy, digital, with the patient, sending content to further engage the patient in self-manage its own disease. What is the objective of that? Reducing readmissions and as such hospitalizations. So why are we doing this as a company? As I mentioned, for us, the success of our customers is our success. We can continue to bring technology to the market. We can continue to bring the latest products at premium prices because they have great quality. But if we don't prepare our customers to optimally use that product, we're not fulfilling our mission to deliver better care to more patients. And we believe as an organization that we have certain capabilities that we use our own factories, we use in our own supply chain. And we have financial means to hire people from other backgrounds as well, management consulting, other geographies, people who have had experience in big transformations like this, to then deploy to the hospital and contribute to the success of our customers. So that's our strategy. We realized that our customers are struggling, and we decided to do something about it.